Now I'd like to welcome Parliamentary Secretary to the Minister of Foreign Affairs, Matt DeCourcey, to the stage. He will be delivering remarks on behalf of the Government of Canada. Matt is also chair of the government's Youth Caucus and served on the Special Committee on Pay Equity and the Special Committee on Electoral Reform. After a 5-month international development project in West Africa, Matt established the Wanderers Friendship Cup, a soccer tournament and health education initiative for youth in the Gambia. He is also a former provincial coordinator for the Canadian Commission for UNESCO's Youth Advisory Group. Matt DeCourcey.
Well, thank you so much for the kind introduction, Caroline. And Stan, thank you for setting the stage so well for the conversations to take place over the next 2 days. And Helen, that was much more than a small summary of the ambitious and important work that your organization is doing. And thank you so much for laying out the breadth of the important work that is being undertaken by all the partners in this room and about this important rallying call for Canada to lead on. It's certainly something that I know as a government we will be supporting and looking to our partners for the continued good work that you are doing around the world. I had the chance to connect with Helen yesterday on a different but related matter and was talking about how pleased I was to be able to join everybody this morning, having had an experience too as a young person finishing a degree to travel abroad and see the important work that Canadian organizations are doing on the ground, delivering health education workshops and sensitization in developing countries. I was in the Gambia in 2010, 2011, working with an NGO out of Halifax, the Nova Scotia Gambia Association, and I had the opportunity to watch young Gambian men and women deliver health education messaging to young Gambian boys and girls. And I was saying to Helen, I didn't realize till later that we were doing much more than just delivering health education messaging, but we were working on gender equality and women's empowerment. And one of the lasting visuals that I can remember is watching the young Gambian women who themselves would have been one of the first generations to receive that health education messaging, passing that on to young Gambian girls in schools and in communities and encouraging them to overcome some of the patriarchal history that comes from that place. I had the chance to visit the country just last week as well, and it was great to see that that work continues, and I'm hoping that people in this room will continue to deliver on the long legacy that we have as Canadians working in partnership with countries in the developing world to deliver not just health education messaging and health education development, but that important gender equality and women's empowerment work that is so inherent in everything that we do. Alors, je vous remercie tous.
Thank you very much for your presence here this morning. I am extremely happy to see as many Canadian experts in the field of health, as well as long-standing Canadian government partners. I am very happy to see Canadian young leaders and developing leaders gathered here.
To watch global health work on the ground. I know it can be complicated, and that many of you will share stories of taking 2 steps forward and 1 step back. Certainly when we set ambitious goals, they require both ongoing efforts and resources, and they require constant connection, communication, and collaboration. And we know that those goals may shake the very foundations of a society, its values, its traditions, its power dynamics. And overcoming those requires time and determination. The key to progress is coordinating our interventions, and we know that that's a complex task. And that's precisely why it's so important to have effective partnerships across government and civil society, academia, and local organizations, and governments on the ground where our programs are implemented. So let me thank you all, CanWatch, for providing this important forum for discussion. Your talks today and tomorrow will enable us to better coordinate our work in the wider context of the Sustainable Development Goals. This is a chance to work together towards our common objective: improve global health and nutrition with a focus on women and girls who are often the most marginalized and the hardest to reach. Canada greatly appreciates the leadership and engagement of our civil society, academic, and health professional organizations in addressing reproductive, newborn, maternal child health and advancing sexual reproductive health and rights. And as our partners, we're proud of what we've accomplished together. Last year's conference on adolescence raised the profile of a neglected but crucial sector in world health. Our collaboration has also resulted in improved coordination of the work being done by Canadian health organizations and institutions, particularly in Haiti. Over the past few months, CanWatch has provided invaluable help in developing a virtual networking platform for NGOs and an interactive map that lists the interventions in progress in each region. Your know-how and these innovative tools will ensure that our work is more in sync so that we can better respond to the needs of Haitians. And for that, I thank you. Vous connaissez tous la position du Canada.
You are all aware of Canadians' position on women and children's health in Canada as well as abroad. For Canada, the most effective way of reducing poverty is to eliminate barriers to equality. We decided to launch our policy last June, being convinced that by creating better social and economic possibilities for women and children, we will be living in a better country for all. And for Canada, sexual and reproductive health is inherent in women and girls. It is a basic right for each of us, and we have to fight against the poverty. We decided to devote $650 million to this program, and various projects have been announced since. And as I said earlier, we made proposals in order to set up partnerships which will be implemented next May. Canada would like each woman and each child to have access to family planning as well as sexual education. We would like them to choose to have a legal abortion if they so desire. We are against early marriages, and we have to put an end to various practices. This is a must.
214 million women in the world who don't have access to contraception. Each year, approximately 3 million girls between the ages of 15 and 19 have unsafe abortions. And in recent times, the Rohingya crisis has reminded us just how crucial it is that women and children in humanitarian situations have adequate health services. Clearly, there is much left to be done, and as I said earlier, the changes we make require time and persistence. But we will not shy away from the task because we know we have great partners in the room to help us achieve our goals. You can count on the Government of Canada to continue to defend the sexual and reproductive rights of women and girls in every form possible, even if that sometimes means ruffling a few feathers and asking tough questions. We're determined to continue working with our health partners to do everything possible to better coordinate our efforts. So let's take this opportunity to explore potential solutions, such as sharing disaggregated health data more systematically, for example, Let's try to find out how we can better align our performance indicators and explore broader monitoring and evaluation approaches. Je suis très intéressé à attendre.
I am interested in learning from you, and I am inviting you to the next conference, which will be held in Vancouver. Please take this opportunity that has been fostered by Me Too movements as well as others to face challenges. Thank you so much.